I'm Steve Adubato. A really important subject we're going to be talking about today with the gentleman about to see on camera, Dr. Rainier Aquino, a vascular surgeon, Meridian Cardiovascular Network, Jersey Coast Vascular Institute. Doctor, we were just talking about this right before we got on the air, the subject of aneurysms. Huge topic, affects millions of Americans and little understood. And I tell you, I have some family history here that I'm not going to talk about on the air, but I'm not alone. Talk about this issue.
Well, first, an aneurysm is a disorder where your normal blood vessel starts to balloon out or bulge out and expand. And the potential is that when it continues to expand, it can burst. And if it bursts, you can have severe internal bleeding that can lead to mortality, lethal issues with that. And it's a common disorder. It affects Americans, 1.5 to 2 million Americans in this country. 200,000 cases are diagnosed by physicians every year, of which 15,000 are potentially lethal because it can burst. So it's something that's fairly common. Also, 10th leading cause of sudden death overall in this country in males.
Why more men than women?
No one really knows why, but generally, for the male population, it affects about 2 to 5% of males over the age of 60, so that becomes a risk factor. Males have a 4 times more risk of developing these aneurysms, although overall aneurysm population, about 20% are females. Other risk factors such as smoking. Smokers have a 7-time increased risk of developing these aneurysms. Smokers. Those former smokers have a 4 times increased risk. And also important is family. There's a 20% genetic link with family members. If you have a father, a mother, or brother, you should find a board-certified vascular surgeon and be evaluated for these aneurysms. And aneurysms, again, can affect any blood vessel in the body, from the brain to the legs. More commonly, it affects the largest blood vessel in the body, and that's in the chest or abdomen.
The chest or abdomen. Let's talk this through. Can we get a shot of this team? Let's take a look. Dr. Aquino, help our team make sense of this, because without you talking about it, we're not going to be able to. Describe what we're looking at right now.
The largest blood vessel in the body is the aorta, and this is the aorta, which is in the abdomen. Its purpose is to give blood to the lower extremities, the lower part of the body, and the abdominal viscera. When typically the size of the aorta is about 1 inch, about 2 centimeters. When a segment of the blood vessel gets diseased, it starts to bulge out and expand, and this is what's known as an aneurysm. When it expands more than its safety margins, then it becomes a critical health risk, because these can, obviously, as you can see in this, it can burst.
Now, what are we looking at right here, doctor?
At the level of your belly button, this is where your artery splits into the left and right iliac arteries that provide blood flow to your extremities.
Got it.
Okay, and
so let me ask you this: the biggest danger here is that if someone doesn't monitor, if someone's not aware that they have a potential problem, an aneurysm in this area, and it bursts, can you deal with it, or is that it?
There's poor survival in that situation.
Why?
Well, it's massive blood loss internally. They may not think that it's an aneurysm, but it's just abdominal pain and back pain. And by the time they get to the emergency room and then the operating room, it may be too late. So patients can experience severe back pain, abdominal pain associated with shock, loss of consciousness, dizziness. All those can occur in that emergent setting, and they have to get into the hospital as soon as possible.
But what's interesting about this is I also think about prevention, okay? I mentioned to you, without going into a lot of detail, that the doctor had picked up. He said, you have a microscopic aneurysm. And it wasn't in that spot for me. It was more in the leg area, he said. I said, oh, okay. He said, when I want this checked out, and he was very specific about what he wanted done. But in all candor, until I was getting ready for the show, I wasn't thinking about it much. Now you have me thinking about it a lot. I'm thinking, well, what do you do? Is there medication? Like, say it's the right physician, the right circumstance, what happens?
There is no medication. It's not going to go away. It's not going to stay, where the size that it's at. It's going to continue to grow in this area.
Because that's what aneurysms do?
That's pretty much what it does. It's a weakening in the wall, and it's going to continue to expand and expand until it can't expand anymore, and that's when you have, when it bursts or rupture. So in general, in the abdominal aorta, it grows about 4 millimeters a year. And so it's important, and that's key, to continue with your physician to monitor its growth, whether it's a 6-month ultrasound,
right,
yearly ultrasound. You continue to monitor its growth until it needs to be fixed. And generally
Define
in this
fix.
area, that's about 5 centimeters.
Fix.
So when we fix it, it's either two ways. There's a traditional surgery, which is the big incision in the abdomen, and we replace this segment by hand with this durable man-made tube-like structure. That's over time, it's about 90% successful. Now, the recovery in the traditional approach is a lot longer. Patients generally go through a lot depending on their circumstances, depending on their comorbid risk factors. The newer approach, which has been around for about 20, 25 years now, is fixing it, not from the outside as we would with the traditional approach, but from the inside, as depicted in this figure, this model, where we would make 2 small incisions instead in the groin and deploy this stent graft from the inside with live X-ray. Generally, recovery is 1 day.
Really?
At least in our practice, we send our patients home in 1 day, but baseline quality of life returning to function is about 4 weeks.
You can't ignore this stuff.
Right. But overall, those are the 2 options for addressing these aneurysms.
Aneurysms cannot be ignored. You cannot cure it, but you can monitor it and stay on top of it, correct?
Yes.
Dr. Aquino, Vascular Surgeon, Meridian Cardiovascular Network, Jersey Coast Vascular Institute. Thank you, Doctor, for joining us. We appreciate it.
Thank you.
Important medical information, health information. Stay with us.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the PNC Foundation, which supports early childhood education through Grow Up Great, the New Jersey Education Association, NJIT, PSE&G, Kessler Foundation, Adler Aphasia Center, and by New Jersey Sharing Network. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com. And by NJ Biz, all business, all New Jersey. Transportation provided by Airbrook Limousine,